Hi there. I'm Wendy Rock. I am assistant professor at Southeastern Louisiana University in Hammond, Louisiana. And I am co-chair of the ASCA Ethics Committee, and I am here today with
Me. My name is Ben Handrich. I am a school counselor at South Salem High School in Salem, Oregon.
All right, we'll jump right in. So our learning objectives for today are to give you all some information about the warning signs of suicide. We're going to also talk a little bit about risk factors and protective factors. We'll talk about how school counselors should respond when they are put on notice about a student who potentially could be suicidal. We'll talk about the legal and ethical issues involving school counselors in suicide assessment. And we'll talk about some resources, because resources are always one of the most important things to get out of a presentation. So we'll share some of those with you. So Ben's going to start us off on some suicide statistics and background.
Yeah. So we wanted to start by just showing you kind of a broad view of the United States. And you can see just as far as visually, the really dark states are the areas where suicide rates are the highest. And then the lighter states are where they are the lowest. States with the top third of suicide rates are associated with increased access to firearms, increase in mental health needs, substance abuse, things like that. Whereas the lowest states tend to have tougher gun laws. They're associated with access to medical services, reduced obesity, economic stability, and like funding for public health. So that's just kind of a broad view of suicide data in the United States. Another highlight statistic that we thought worth showing was suicide rates by age. On this slide, you can see that, our highest risk people are people aged 45 to 64 years old. And the trend is going up. You can see that it looks like in 2019, things kind of leveled out, but, and we don't have data around COVID times specifically. Our assumption is, though, that during COVID, these numbers probably continued to rise. Did you want to add anything there, Wendy?
No, I think you got it.
Okay. Access to lethal means, this is something that is very important to bring up. Historically, when people have talked about suicide, they've talked about the why. Well, why did the person do this? Anymore, I think most people are talking about how. How are people doing this? Often suicide crises are brief, and a person, when they're having this crisis, they turn quickly with little planning to whatever they have at their disposal. So access to lethal means, it's an important consideration when we're talking about trying to lower the number of deaths by suicide. So in this slide, some suicide methods are far more deadly than others. As I'm sure you guys know, case fatality ranges from 1% for some methods to 85 to 90% for the most deadly firearms. And then 90% of those who survive even nearly lethal attempts do not go on later to die by suicide. And these are some pretty intense visuals here, but just to show you guys what means of suicide looks like. For males, you can see that hands down, the way that most males die by suicide is firearms. It's almost above 50% for every single age category. And then other ways that males die by suicide would be poisoning, suffocation, and some others. Females, it's a little bit different. There's more of a balance between these four different areas, and firearms is pretty similar to poisoning and suffocation across age groups.
I want to just jump in for a minute, Ben, and point out something in case the audience isn't aware. But I noticed in your language that you say die by suicide and you don't use the commonly known term commit suicide. And I think that's important to just point out that it's important to have that shift in language because when we talk about committing crimes, we talk about committing in terms of a bad thing, and we want to reduce the stigma of mental health. And so to say die by suicide is a preferred way to talk about it instead of commit suicide.
Yeah, thank you for that distinction. Absolutely. Okay, so last slide before we jump into a new section. What's the takeaway from this research? You know, for Wendy and me, as we're going through this process, we want it to be clear that it's important to take all suicide warnings seriously. And we haven't actually said this yet, but to avoid language like low and high risk when communicating about suicide ideation to a student, family, or appropriate staff members. That's a theme we're going to bring up over and over again, but it's not our job as school counselors to assess risk of a student. It is our job to gather information when a student is showing warning signs or has risk factors around suicide, and to communicate that to parents. So take anything you see or hear seriously when communicating to student, family, and appropriate staff members.
So with that, we'll jump right into what are some of those warning signs, risk factors? What are the protective factors, and what is our response? When we talk about warning signs, we think about actual behaviors, observable things that we can pick up on in a student or someone, things such as stockpiling pills, acquiring a gun, giving away personal belongings, increased drug and alcohol use. I think, you know, a lot of times we think about some things that are just warning signs in general are changes in typical behaviors, sleeping patterns, eating patterns, withdrawal from friends. If we see those types of changes, those should be red flags that there's a problem. But with suicide warning signs in particular, dramatic mood changes, non-suicidal self-injury. And it's important to note too, that just because it's a warning sign, that doesn't mean that someone who, for example, is cutting will definitely attempt suicide later, but it is a warning sign. So everybody who cuts doesn't attempt suicide, but people who attempt suicide oftentimes engage in non-suicidal self-injury. So it's important to be aware of the warning signs, make note of them, and be able to communicate them with family members when you see them. More warning signs, increased apathy, a strong wish to die or a preoccupation with death, talk of being a burden to others. I would also say, and Ben, I think you can probably comment on this, you know, I was a school counselor for 19 and a half years, and now I am in higher ed. So I'm not working directly with students, but you still are. But in conversations counseling students, one of the things that was hard for me as a new practitioner, but I got more comfortable with, is when you just get that, it's like a tingly feeling or something in your brain telling you, I should ask the question. And maybe there's something saying, I really don't want to ask the question. It's Friday, it's 2 o'clock, we're about to go home. I just don't want to ask the question. If you have the tingly feeling, you need to ask the question. Any thoughts on that?
Yeah, 100%. I find myself asking the question. As a school counselor for this is my 7th year now, than I would have in my 1st and 2nd year, just because I always want to check in with students. And the worst case scenario is that they're like, Mr. Handrich, no, I'm not thinking about that. And I can have a sigh of relief and say, okay, I want you to know anytime that, I'm here for you anytime you need to talk to me. But I'm glad to hear that right now you're not having those thoughts. So that's worst case scenario, is a miscommunication. But yeah, that tingly feeling, absolutely.
Risk factors are more like environmental, the environment leading to potential risk for suicide. So having a diagnosed mental health disorder, having substance use or alcohol use, impulsive behaviors, previous suicide attempts, access to lethal means, all of these are risk factors. I do want to specifically hone in for a minute on the alcohol and substance use, because one thing that alcohol and substances do is lower our inhibitions when we're intoxicated, right? And so the research has shown that approximately 22% of deaths by suicide involved alcohol intoxication with a blood alcohol content above the legal limit. That was from the CDC. And opiates, including heroin and prescription painkillers, were present in 20% of suicide deaths. Marijuana, 10.2%, cocaine and 4.6%, and amphetamines and 3.4%. So we know that especially when someone is in crisis, if they use alcohol or drugs during the crisis, that could increase their risk substantially. Other risk factors that we know, of course, are things like bullying. Suicides happen in clusters in the community. So if there's one suicide in a school community, you have to be alert that there could be others. That raises the risk. Criminal or legal troubles. I'm not going to read them all to you. They are here on the slide, but it is just important to be aware. And it's also important to know that the factors that Ben and I have listed, both the warning signs, the risk factors, and we're about to go into protective factors, are not an exhaustive list. There are many other risk factors and warning signs, and we're going to give you resources where you'll be able to look this information up, but it's important to just be aware. It's important to note too that these risk factors can vary across groups. So age group, culture, sex, and other characteristics. And there's just a few examples here. And this is from the Suicide Prevention Resource Center. So thinking of prejudice and discrimination, whether that's family rejection or bullying or violence, this is a known risk factor, particularly among lesbian, gay, bisexual, and transgender youth. But also think of prejudice and discrimination for other marginalized people from marginalized populations. Historical trauma, for example, suffered by American Indians and Alaskan Natives contributes to a high suicide rate in that particular population. And for men in the middle years, stressors that challenge traditional male roles, unemployment and divorce, have also been identified as important risk factors. I think one of the things I took note of, this is not from the research, but just from my experience, that high school students, oftentimes in the midst of a breakup with a significant other, that would be a particularly challenging time for them. Anything to add, Ben?
No, that's great.
So, in particular, our LGBTQ youth are at a higher risk, particularly if they have experienced discrimination based on their sexual orientation, their gender identity, also race and ethnicity. That you know, being a person from now the word's going to escape me, but intersectional identities, they report a much higher rate of attempting suicide compared to those who reported experiencing these 3 different types of discrimination. This is the highest rate of attempting suicide. So having those affirming spaces and inclusive policies and practices in place are associated with lower rates of attempting suicide. It is really important that we create safe spaces in our schools for our students. And well, not just safe spaces, but really we need to have the entire building be a safe space for our school, for our students. And then survey results demonstrate that respecting transgender and non-binary youth's pronouns, allowing them to change their name or gender marker on legal documents is also associated with lower rates of attempting suicide. And particularly when you have affirming homes and schools and online communities, this can also correlate with lower risk factors. So some protective factors, these are the things in the environment that would support a student where they would be less likely to make a suicide attempt. So when these are things that are in place, and I think these are important to consider when we're thinking about how to create that safe school environment, there are things that we can do to increase protective factors. So life skills, having coping skills and problem solving skills and the ability to adapt to change. Cultural and religious beliefs that discourage suicide are protective factors. Having connections to friends and family and having that community support. And supportive relationships with care providers. So definitely creating those connections with teachers, with other people and other educators and other people who work in the school building. The availability of physical and mental health care, limiting access to lethal means, and then self-esteem and a sense of purpose and meaning in life, and future planning. And we're going to talk about that in a little bit. That future planning is really important. And I'm going to turn it over to Ben.
Okay, so yeah, we wanted to talk, and this is kind of like the meat and potatoes of this presentation. I would say the counselor role in the suicide assessment or response process. We put response in parentheses because many districts use an assessment tool when they are asking counselors to work with a student that possibly has suicide ideation. And we are trying to help move away from that assessment model towards more of a response or an information gathering model. But not all districts are there yet, and we want to acknowledge that. So for many districts, you might be using a suicide assessment process, but as far as going through this response process, you can do that even if you're using an assessment tool for documentation. So within the response, you know, the first thing when you have that kind of like spidey sense or that tingly feeling that like, I think this student is exhibiting enough warning signs or risk factors that I need to check in with them. Ask them the question. And that question is, are you thinking about killing yourself? I always recommend for new counselors to be as direct as possible. You know, saying like, do you ever wish that you could go to sleep and never wake up? That's an okay way to start the conversation, to transition towards asking directly about suicide. But it's important you ask directly. A lot of other people really like to use the sentence frame of like, you know, when other people are experiencing these really hard challenges that you're experiencing, sometimes they're thinking about killing themselves. And I'm just wondering, have you been thinking about that? That's another great way to ask the question, as long as you're direct. You know, the other thing I would say around the question itself, since it's so important, is sometimes people will accidentally ask the question kind of rhetorically. Like they might say, you know, you're not thinking about killing yourself, are you? And of course, when you ask it in that way, it is implying a certain response. And you want to make the question open. So it needs to be an open-ended question that the person you're asking it of has the opportunity to be vulnerable and say yes or say no. So always ask that question when a student's exhibiting warning signs. If the student says yes, I have been thinking about suicide, it's time to administer your district's information gathering protocol. And like I said, that might be an assessment tool. But within the framework of the assessment tool, it's important that you always kind of hit some basics. And the first big thing is to develop a connection with the student. It could be considered like the therapeutic alliance or a working alliance with the person where they trust you, they know that they can connect with you. And that means giving them space and time to share their story. So develop that connection. And then it's all about identifying the warning signs, identifying risk factors that are causing suicidal thoughts within their environment, identifying protective factors or sources of strength that will help them get through hard times. And that's something that you can also then relay to parents as well in that parent communication. Communicate with parents and guardians. And like I said earlier in this presentation, avoid using language like low and high risk. Like, I checked in with your kid. They shared that they're having thoughts around suicide. But, after talking through it, we had a really good conversation, and I think that they're going to be okay. I wanted to let you know just in case. What I just did is an example of assessing the level of risk, and you want to avoid using language like that. You want to take all signs seriously and just share that, yes, you have a concern because there was conversation around suicide ideation, and that student was exhibiting signs of suicide ideation and said, yes, I want to kill myself. And then just sharing the information that you've gathered. The next part is to help equip parents with local resources. So I always include a follow-up email to all of my parents that I've talked to that has phone numbers and links to crisis hotlines, like our local support agencies in my area in Oregon, but then also some national hotlines as well. And we'll have some of those at the end of this presentation. And then always consult with your administrator and counseling team as needed throughout. It's never a perfect process as you're working with a student, trying to also connect with an admin to make sure that they're a part of the conversation, or if you need to consult with a counselor, having to briefly check in with one of them while also continuing to monitor the student. It can be messy, but it is a part of the process. And then follow up with the student post conversation, post information gathering, post parent conversation, as much as you are able. Did you want to add anything there, Wendy?
Nope, that's great. You did a great job.
Okay, so communicating with families, this part, again, communicate the facts and details, including warning signs, risk factors, and protective factors. Those are the big things you want to connect with them on. Provide a listening space for the parent once you've shared that information that you gathered. You just dropped a big bomb into their lives, and they need you to be willing to give space for comment after that conversation. Provide a list of resources in your area, like we said, and follow up with an email providing the same information. I have an email template that I use that I always just send out with resources to parents. So creating something like that for yourself can be really handy. And again, this is going to just keep coming up. Avoid using language like low and high risk. Okay. There are some brief interventions as well that have been proven to be very effective when you're working with a student that is suicidal. Safety planning is one of those things. Personalized safety planning has been shown to help reduce suicidal thoughts and actions, helping the student and their family develop a plan that describes ways to limit access to lethal means such as firearms, pills, and poisons. So again, that's the how question, right? If they were trying to die by suicide, how would they be doing it? And do they have access to those things? So helping to eliminate access, at least temporarily, even if they are a student that's taking medication for anxiety or depression, having parents administer those pills and having them all locked away, that would be part of the safety planning process that's proven to be effective. Also, follow-up phone calls. It sounds simple, but research has shown that when people at risk of suicide receive further screening, a safety plan intervention, and a series of supportive phone calls, their risk of suicide goes down. So again, that's part of that connection piece. That's why we wrote that into the response section. Connecting with student, connecting with family is huge. And so that's a really important part of the intervention process. Finally, cultural confidence. So yeah, you can see here, your interventions will be more effective when they are respectful and responsive to the values, beliefs, practices, strengths, and needs of your students and their families. So this is written into our protocol in my district as well. We do have some cultural implication questions, just checking in to make sure we've considered culture as part of our process. So yeah, considering context, if you're working with a Pacific Islander student versus a Latinx student versus an Alaska Native student versus a white non-Hispanic student, what cultural factors are at play for that person, and consider it as part of the process. Okay, we're going to jump into legal and ethical considerations, where once again, Wendy's going to jump in.
Great, thank you. Yeah, so the legal and ethical considerations, why is this whole process so important and why do we have to get it right? Well, obviously, because we want to keep our students safe. That's the number one primary goal. But also we want to protect ourselves from liability, and that's important as well. So suicide assessment processes are oftentimes very paperwork centered, and we want to move away from that. We want to stay connected to our students. We want to, as Ben mentioned, like build that connection. That therapeutic alliance is so much more important than checking off a list of boxes. There is a plethora of research out there that has demonstrated that no risk assessment or protocol can predict suicide outcomes with any type of certainty. It's really impossible to implement these protocols with fidelity, and it puts counselors and districts at risk of litigation. So ethical standard A9 talks about serious and foreseeable harm to self and others. And Ben, I can't remember if this is from the 2016 iteration of the ethical standards or if it's the new 2022, which will be available July 1.
I can't remember either.
Both say very similarly. I think in the 2022 iteration, it's worded even more strongly that it is our duty, our responsibility to inform parents, guardians, and the school administrator when a student poses a serious and foreseeable risk of harm to themselves or to others. And we have to notify the parents and guardians and the school administration after careful deliberation and consultation with other professionals, such as other school counselors. Ben mentioned that, the school nurse, the school psychologist, the school social worker, the school resource officer, maybe Child Protective Services. If the student is considering suicide because of an abusive home environment, then we may not be informing parents right away. We might be informing Child Protective Services and administration. Even if the danger appears, and we've said this a number of times, relatively remote, it doesn't matter how remote, we still notify parents and guardians, because the risk that we take in not notifying parents and giving them the chance to intervene on behalf of their child, it's just too great. So what does the research tell us? These are just samples of 4 research studies that are out there that demonstrated that as trying to assess or quantify risk, low, medium, high, it's about the same as a toss of a coin. So if you look at the first column, the 2016 meta-analysis that was done, it states that an in-depth assessment of risk factors would predict a patient's future suicidal thoughts and behaviors with the same degree of accuracy as someone with no knowledge of the patient who predicted it based on the flip of a coin. A 2017, so a little bit more research, a little bit more recent research found that 95% of patients assessed as high risk did not complete a suicide. 50% of patients assessed in low risk did complete a suicide. It's just too hard. We can't predict human behavior like that. We can look at the warning signs, we can look at the risk factors, we can look at protective factors, and we can provide information to parents to give them an opportunity to intervene. That's what we're able to do. And so there's some court cases that are really important around this. Eisel versus the Board of Education was the first one. Nicole Eisel was a student. She told her friends she was planning a suicide pact with someone else. The two friends reported to their counselor. Their counselor consulted with Nicole's counselor. They called Nicole in and Nicole said, no, that's not true. I'm not thinking of suicide. They sent Nicole on her way, who later consummated a suicide pact with a friend. And in this particular case, in Maryland, it was the first suicide case that was brought against a school counselor, and the Maryland Court of Appeals ruled that the school counselor had a duty to notify the parents of the 13-year-old student who made the suicidal statement to her classmates. They cited as critical to the case the in loco parentis doctrine, which states that in absence of the parent, we at school, educators, including the school counselor, legally stand in place of the parents. And furthermore, that the school counselor owes a special duty to exercise reasonable care to protect a student from harm. And this goes into the idea of negligence, where there is a duty owed, and that duty owed is breached, and there's an injury, and you can connect the injury back to that duty that was owed and breached. And that's what they said in that Eisel case. So that led to the duty owed, and to try on our part as counselors to intervene and prevent a student's suicide. So Eisel strengthened a school counselor's legal obligation to the students by satisfying for the first time that primary element of negligence, declaring school counselors have a special relationship and owe a duty to act when they're placed on notice that a student is possibly suicidal. The Rogers versus Christina School District case, in this case, the school counselor, or the counselor, it was a mental health specialist in this case, met with a student who had admitted earlier suicidal ideation and an attempt 2 days earlier. This counselor spent 4 hours with the student, determined the student was no longer suicidal, and sent him back to class. And the Delaware Supreme Court in this case were unanimous that the Christina School District's written protocol provided sufficient grounds for a negligence claim in this case. So the district's protocol included mandates to stay with the student, assess the situation, contact the parents, get help, document, file, and follow up. So not only do school counselors owe a duty to the student, but we have to follow our school district's protocol. It's one reason why it's important that school district protocols not be so excessive and expansive that we're liable to skip steps along the way because we don't think they need to be done, because that can get us into trouble. Two other cases, the Michael case, Michael, very similar to the Rogers Christina case in that the parent alleged the counselor did not follow her school district policy when dealing with suicide threat. The counselor sent the child back to class after the parent offered to come pick the child up, and the child had made a statement he wanted to blow his brains out. The counselor told the parent that the threat was a result of his learning disability and did not advise her to have him examined by an outside professional. The counselor had the student sign a safety contract, just basically stating that he would not do anything to harm himself. Those have been found to be unreliable and not helpful. 2 months later, the student did die by suicide at home, and the counselor in this case was sued. And in the Gallagher and Loudoun County School District, in this case, a student's friend contacted the school counselor to explain that her friend was talking about suicide. The counselor called in the student said he was not going to harm himself. Not only that, he was 18 years old, and he asked the counselor not to contact his parents. And the student's family has elected in this case, and this is interesting, to sue the counselor and not the school district to avoid the school district shield of governmental immunity. So immunity protects government officials from lawsuits and only allows lawsuits where officials violate a clearly established statutory or constitutional right. So in order to circumvent governmental immunity, the parents are going directly after the school counselor. According to the court documents, the counselor violated the standard of care by diagnosing the teen as not at risk of harming himself, which they said was outside the scope of the school counselor's training, because we can't predict how a human is going to act in the future. And an additional violation is that the suicide prevention procedures require the parents be notified of any suicidal ideation. It's also really important to be aware of your state laws and your district policies. Ben and I can't know the state laws of all 50 United States and the territories, but we can know our state laws. So we put on here as examples the laws in Oregon and laws in Louisiana around suicide. In Oregon, they have Addie's Act. In Louisiana, we have the Jason Flatt Act. And it's important to know what your school district policies are as well as your state laws. So just a brief scenario, and we can talk about this more in the Q&A that will follow, but Cameron referred to you by two of his friends who told you he was making statements about not wanting to be here anymore, and he appeared really sad. So you talk to Cameron, who tells you he just broke up with his significant other he had been with for 6 months. He says that what he meant is he just doesn't want to be at school. He assures you he's fine, but you are going to just be safe, and you follow your school district's protocol of using the Columbia Suicide Severity Rating Scale, and that scale tells you he's low risk. What do you do? So just as a review, and this is what Ben went over earlier, when we use the suicide rating scale, if possible, maybe we can use those questions as guiding questions to get information about warning signs and risk factors without actually filling out the piece of paper, because that Columbia Suicide Severity Rating Scale is going to give you a level of risk, and we don't want to do that if we can avoid it. But we also have to follow our school district policy. So if that is your school district policy, you may want to try to start advocating for change in your school district. But you always want to ask. So we want to ask Cameron, are you thinking about killing yourself? And then we want to develop that connection with Cameron, identify warning signs. The fact that Cameron spoke to his friends, a lot of times students are going to be more likely to share information with their friends than they will with adults. We have to take that seriously. So we're going to communicate that with, even if Cameron says to us, no, I just don't want to be at school anymore, we can share with the parents. Cameron's friends came to me with a concern because he talked about not wanting to be here anymore, and he appears really sad. And these are some warning signs that we see for suicide. You can communicate that, identify the warning signs, identify those risk factors, those protective factors, and communicate your concern with the parents without saying low, medium, or high. And then give them local resources. You can take Cameron to the emergency room for a full evaluation, or maybe you have a list of mental health resources in your community. You share that with the parent. Make sure that you have been consulting throughout this process with your administrator and with your counseling team, and follow up with Cameron, follow up the next day, follow up with Cameron's family, ask if they have seen somebody, what their process has been. Let's talk about some resources, lessons, and supports. Ben, I'm going to turn it over to you.
Awesome. Okay, so yeah, some mental wellness proactive supports. You know, when you think about suicide protocols, you often are thinking about that intervention you're doing at the time with the student. But there are a number of preventative supports or proactive supports that are great opportunities to talk with students about mental health, to talk about healthy living. And so we'll go over a couple of those things, but in general, some proactive supports, working with teachers and administrators, having school-wide suicide prevention programs. You know, at South here where I work, we use a program called Sources of Strength, and it's just helping students to identify what those sources of strength are for them when they're going through hard times, and when they're just and in normal life as well. And there's lots of different preventative programs like that. They call them like upstream supports. Classroom instruction is huge, building in mental health units, building in suicide prevention units where you talk through what to look for if you're worried about a friend, and what to do if you have a friend that is thinking about suicide. Family education, working with families. In our district, we have a whole site that's devoted to resources around suicide prevention and mental health to help all of our families. And then, this is getting a little bit less system thinking and more like individual thinking, but small group counseling to increase coping and problem solving skills is also a great option. At South, we have lots of clubs they're clubs, but they're actually mental health support opportunities for students. One of those clubs is Sources of Strength. We have one that's called Saxon Strong, that's a mental health advocacy group. And then there's just a number of different supports that we have through clubs for students that I would consider proactive supports. If you have a Gay Straight Alliance at your school, I'd consider that a proactive support for a really vulnerable population. So lots of opportunities for proactive supports. We put a number of different lesson plans into this PowerPoint. And instead of going over each one, we'll just have them here. There'll be a resource that you'll have access to, but there's one for grades 7 through 12. 1 or 2 50-minute periods for activity plus 30 minutes for viewing the video. There's another one from the Virginia Department of Education for grade 9 specifically. And again, you guys will have access to these if you want to take a look. There's one from the Wisconsin Department of Public Instruction, Student Services, Prevention, and Wellness. Again, this is another high school, middle to high school grade, and there's multiple lessons here. And we did make a note down at the bottom. In elementary grades, lessons that focus on social and emotional development can help reduce the risk of suicide. According to one study, the risk factors associated with suicide behavior were decreased by providing emotional regulation strategies. So those social emotional learning opportunities with young students and helping them learn to regulate their emotions and just to develop some sense of self-awareness are great prevention strategies. We also said we'd have, a couple evidence-based suicide prevention options here. You can see a bunch of different trainings that you can use that are kind of those intervention-based trainings. My district, we use ASSIST, so Applied Suicide Intervention Skills Training, and we also have QPR gatekeepers that also help train suicide prevention. ASSIST, because it's a more involved process. In our district, at least, only our counselors are trained in ASSIST and our social workers, whereas QPR, for instance, like I'm one of our gatekeepers that does training for our district, but we train all staff throughout the entire district in QPR. So that's a more broad spectrum approach, and it's about a 2-hour training, whereas ASSIST is a more intensive 2-day training. But you can see there's lots of different great opportunities, great programs that districts can buy into on this list. Some more resources here, just for your guys' awareness. This is where we got a lot of our information, a lot of our data and statistics around suicide in the United States and suicide prevention. And here are some of the regional and national hotlines. Some of these are what I include in what I was talking about with a follow-up email to parents. These are things that we can provide students with. There's some great like text to teen opportunities where students can actually just text a number and they'll be connected then with a peer that can reach out one-on-one with them that's trained in suicide intervention strategies. Anything there that you want to add before we move on, Wendy?
I don't think so. I think that's a lot of good resources, and they'll have access to those, I'm sure, after this presentation.
Mm-hmm. Yeah, absolutely. So Some session takeaways as we kind of wrap this up. Remember that when a student is displaying warning signs or has risk factors for suicide, always ask them directly about suicide. Are you thinking about killing yourself? You know, when people are experiencing what you've experienced, sometimes they're thinking about killing themselves. And I'm wondering, is that something that you're going through as well? You know, finding a way that's comfortable for you to ask directly. When communicating with families about suicide ideation, never use language that assesses the risk of the student's suicide ideation. And all of those court cases that Wendy went through today, those are just real world examples of how potentially dangerous it can be when we decide to assess risk instead of taking all signs seriously and communicating that information to parents. And then work towards equipping parents with the resources they need to help their child in crisis. I think it's easy for counselors to try to take on the burden of a student experiencing suicidal thoughts all for themselves, find all the resources, find all of the counseling, and try to step through every single doorway with that student. But we want to equip parents with this. You know, this is becoming a more and more challenging topic as we see more and more students having thoughts around suicide. And we need to be equipping parents to access the resources in our community so that we're not trying to take on that burden by ourselves.
So just some references from where a lot of our information came from. Also, you saw that in our resources as well. And there will be a live Q&A for this session, so we will see you there. Anything else, Ben?
I think that's it. Thanks for being with us in this presentation, everyone.
Yes, and don't forget to complete the session evaluation. See you soon.